If you are cutting salt and your blood pressure still is not improving, there is a reason, and it has far more to do with your hormones than your salt shaker. The salt conversation is the short game. What actually drives blood pressure long-term is a hormonal chain that often does not get fully explained in a 15-minute appointment. And once you understand it, managing your numbers will never look the same again. I'm Dr. Mandy Thomas. Today we are going deep. Why blood pressure matters as much as it does, what is actually driving it in most people, and what you can realistically do about it. Drop a comment below. Has your doctor ever talked to you about the hormonal side of blood pressure? I read everyone. Let me give you the core idea right at the start, and then we will build the full picture around it. The real driver of blood pressure, for most people, is not sodium directly. It is a hormone called aldosterone, and the thing driving aldosterone is insulin. High insulin drives high aldosterone. High aldosterone causes your kidneys to retain sodium and water. More fluid in the bloodstream means more pressure on arterial walls. That is the chain. And the place to break it is not the salt shaker. It is blood sugar. That is the thesis of this entire video. Now let me build the full picture so you understand exactly why this matters and what to do about it. Why blood pressure deserves this level of attention. Your cardiovascular system is a closed loop with no overflow reservoir. Pressure inside it is determined by two things: how much fluid is circulating and how hard the heart is pumping it. When either rises, arterial pressure rises, and that pressure causes damage over time to the delicate lining inside your blood vessels, setting the stage, gradually and silently, for stroke, heart attack, and kidney failure. There are no warning symptoms. That is why it is called the silent killer. This is also why a landmark 2015 clinical trial called the SPRINT trial permanently changed how physicians approach blood pressure targets. Patients kept tightly controlled, top number below 120, experienced significantly fewer cardiovascular events, less kidney damage, and less harm to the heart, brain, and eyes than those allowed to sit in the low 130s. The trial was stopped early because the difference was that clear. Tighter control protects organs at a level you cannot see or feel, quietly, every single day. One important note before going further. If you are currently on blood pressure medication, do not stop it, not without working closely with your doctor. If you have a history of high blood pressure, you have likely had chronically elevated insulin for a significant period. When you start making dietary changes that bring insulin down, your body needs time to recalibrate, and going off medication abruptly during that transition can be dangerous. Treat this as a partnership with your physician. What this means practically, and this is where most people get misled. The first step is understanding what drives chronic insulin elevation. Insulin is released by the pancreas every time blood glucose rises. When you eat in a pattern that repeatedly spikes blood sugar throughout the day, particularly through refined carbohydrates and added sugars, insulin is essentially in a constant state of elevation. Over time, cells become less responsive to it. The pancreas compensates by pumping out more. You end up with persistently high insulin even when blood glucose looks acceptable on a standard lab panel. This is one of the most underappreciated health issues in primary care right now. Millions of people have elevated insulin and have no idea because their doctor ordered only a fasting glucose or a hemoglobin A1C. Those tests can look acceptable while insulin is already chronically elevated and silently driving aldosterone, damaging blood vessel health, and pushing blood pressure higher year by year. Here is what that looks like in real life. It looks like someone who removes the salt shaker from the table, reads every nutrition label for sodium, and still cannot get their blood pressure numbers to move meaningfully because their breakfast is cereal, their lunch is toast and crackers, their afternoon is biscuits, and their evening is dessert. The sodium is lower. The insulin is still chronically elevated all day. The aldosterone chain is still running. The blood pressure stays high and they cannot understand why. I see a version of this regularly in clinic. A patient comes in frustrated. They did everything their doctor said about sodium and their numbers barely moved. We look at their eating pattern and see high carbohydrate meals spread throughout the day, blood sugar spiking repeatedly, insulin never getting a chance to come down. We shift the focus from sodium to meal composition and meal timing. Within 6 to 8 weeks, their morning readings begin dropping, sometimes more than 10 points, without any change to their medication. The numbers did not move when they cut salt. They moved when we addressed the hormonal chain that was driving the problem. Now here is what that means at the level of daily habits. The dietary goal is straightforward. Reduce the frequency and magnitude of insulin spikes throughout your day. In practical terms, this means significantly reducing refined carbohydrates and added sugars, eating in patterns that allow insulin to come back down between meals rather than staying constantly elevated, and not grazing continuously through the day. Some people respond well to moderate reductions. Others with more advanced insulin resistance may need to be more aggressive about carbohydrate reduction to see meaningful improvements. Physical activity is one of the most powerful tools for improving insulin sensitivity. When muscles are regularly worked, they become more efficient at absorbing glucose from the bloodstream without requiring as much insulin. This directly keeps insulin lower, aldosterone lower, and blood pressure in a healthier range. The effect of consistent exercise on blood pressure is well established, and much of that benefit runs through exactly this hormonal pathway. Sleep is another factor that does not get nearly enough attention. Even a few nights of poor sleep can measurably increase insulin resistance, which starts pushing the hormonal chain in the wrong direction. If you are doing everything right with diet and exercise, but chronically sleeping poorly, you are fighting with one hand tied behind your back. Chronic stress also belongs in this picture. Cortisol, the stress hormone, has complex interactions with blood sugar regulation and insulin sensitivity. Long-term unmanaged stress can undermine improvements made elsewhere. Recognizing that stress physiology has measurable effects on metabolic health and building intentional recovery practices into your routine is part of the complete picture. What to realistically expect. If you have had elevated insulin for years, the reversal will not happen in a week. Meaningful hormonal recalibration takes consistent effort over months. In the first weeks, you may see early improvements in blood sugar and some reduction in blood pressure. There will also likely be periods where progress feels slow. This is normal. What you are doing is changing the metabolic environment your blood vessels live in, and that change is real, durable, and not reversible the moment you return to old habits, the way a crash diet would be. As insulin levels come down, aldosterone will follow. As aldosterone drops, your kidneys will naturally excrete more sodium, blood volume will decrease slightly, and blood pressure will ease. At that point, your doctor may begin a conversation about reducing or adjusting medication, because at that point, you have not just changed the number, you have changed the system generating that number. The broader point. The conventional approach to blood pressure is highly reactive. Numbers climb, medication is prescribed, and medication is managed for life. Medication absolutely has its place, particularly when blood pressure is severely elevated and immediate risk reduction is necessary. But it should be a bridge, not a ceiling. The underlying drivers are responsive to lifestyle. They are not fixed. They are not simply your genetics or your destiny. They are influenced by what you eat, how you move, how you sleep, and how you manage stress. I have seen patients on multiple blood pressure medications commit to this metabolic approach and work with their doctors over time to reduce or, in some cases, eliminate those medications because their underlying hormonal environment genuinely changed. That is what becomes possible when you address root causes rather than just numbers. Your blood pressure is not just a number. It is a window into your metabolic health and your hormonal environment. If it is high, your body is communicating loudly. The question is whether you are responding to the right message. If you are currently managing high blood pressure, talk to your doctor about getting a clearer picture of your insulin levels, not just blood glucose. Ask about insulin sensitivity testing. Begin making the dietary and lifestyle shifts that support it. And do not adjust medications without medical supervision, but do start working toward the day when that conversation becomes appropriate. If your blood pressure is currently healthy, do not tune out. Keeping insulin sensitivity high is preventive medicine in the truest sense. It is how you protect your aldosterone regulation and your blood pressure for years and decades to come. Prevention is always more powerful than treatment, and the earlier you build these habits, the more protected you will be. I've put together a free blood pressure and metabolic health guide, a one-page printable showing the insulin-aldosterone blood pressure chain, the key foods and habits that support healthier insulin levels, and the specific questions to bring to your doctor at your next appointment. Print it and take it with you. The link is in the description. I created this for my clinic patients, and it is available here for now. Drop a comment below. Were you aware of the connection between insulin and blood pressure before watching this? I read everyone. Subscribe if you haven't. Share this with a senior you care about who is managing blood pressure. This is the explanation most doctors do not have time to give in a 15-minute appointment. Next video, the 3 natural interventions shown in clinical trials to lower blood pressure, sometimes by as much as medication. I'll see you there. This video is for educational purposes only and does not constitute medical advice. Always consult your healthcare provider before making changes to your diet, medications, or health routine.